Scenario 5. Human Development. Real Scene 2. Cosmetic Surgery. The science which deals with sensuous perception. Anonymous. My goal. After completing Scenario 5, I will have increased my vocabulary and learn to construct statements in present continuous tense. I will also have practice creating yes-no questions and WH questions, and I will understand how to use quantifiers. I will also be introduced to the future tense using will. The reading material will teach me about various forms of plastic surgery.
Introductory questions. Number 1. Have you ever considered having plastic surgery? Why or why not? Number 2. Do you know what the first cosmetic surgeries were and where they took place? Number 3. What is your opinion about cosmetic surgery addiction?
Plastic surgery. Plastic surgery is a branch of surgery which deals with the repair or replacement of malformed, injured, or lost organs or tissues of the body, chiefly by the transplant of living tissues. The word plastic derives from the Greek plastikos, meaning to mold or to shape. Plastic surgery includes two broad fields. Reconstructive surgery, including microsurgery, focuses on reversing or masking the destructive effects of trauma, surgery, or disease. Reconstructive surgery often involves correcting defects by moving tissue from other parts of the body. Cosmetic or aesthetic surgery is most often performed in order to change features that the patient finds unflattering, but which do not seriously affect their overall health and wellness. Occasionally, cosmetic surgery is performed for medical reasons such as breast reduction surgery in the case of orthopedic problems.
Listening. Conversation. Are you thinking about changing your appearance? Sure, I am really serious about it. I scheduled a surgery for next week. What kind of surgery are you having done? Well, it's called Liposuction. It is a procedure to remove body fat based on established ultrasound technology. Are you scared? No, it's going to be very easy. This technology is so advanced that it can target sensitive areas, such as the neck and face, as well as the arms, back, hips, and legs. The nerves, blood vessels, and connective tissue remain virtually undisturbed. Well, good luck to you. See you next week.
Grammar Structure 1. Present Continuous Tense. The present continuous tense is used to talk about action happening now, action in the future, actions in progress in the present. E.g., you are reading these words now. I am living with my sister until I find an apartment. I am taking my exam next month. When are you starting your new job?
Writing. Complete the conversation using the given verbs in the appropriate tense.
Hi Kim, what you do?
My blood tested today. Get.
What time you do that?
I'm not sure. The medical center about my appointment. Call.
When you expect to have surgery?
It's to be next Monday. Go.
History. Surgical procedures for purely cosmetic purposes can be traced back to the ancient world. The Romans were able to perform simple procedures such as repairing damaged ears and, in the Middle Ages, a technique existed to restore a severed nose by attaching the arm to the face, letting a blood supply form and then removing the arm from the new nose. Physicians in ancient India were using skin grafts for reconstructive work in the year 800 BC. However, while cosmetic surgery existed, it didn't evolve very quickly, and it wasn't until the birth of technology in the 19th and 20th century that it became commonplace. The first official plastic surgeon was Dr. John Peter Metawa, an American who performed the first cleft palate operation in 1827 with instruments that he designed himself. Reconstructive surgery. Reconstructive surgical techniques developed rapidly in the period after the First World War, when patients with survivable but disfiguring injuries required treatment. The English military hospitals of the period trained surgeons from all over the world in reconstructive surgical techniques. Presently, plastic surgeons use microsurgical techniques to transfer remote tissue. They have, for the past several decades, been able to connect blood vessels as small as 1 to 2 millimeters in diameter to transfer tissue, thereby allowing a coverage of a soft tissue defect when no local tissue is available. Common uses of reconstructive surgery are breast reconstruction for women who have had a mastectomy, facial and contracture surgery for burn victims, and the closing of skin or mucosa defects after the removal of tumors in the head and neck region. Sex reassignment surgery for transsexual people is another example of reconstructive surgery. Foreskin restoration for men who have undergone circumcision is sometimes performed using reconstructive surgery. There is a definite gray area between reconstructive and cosmetic surgery. For instance, bad ear correction procedure is not considered cosmetic surgery, even though having prominent ears is not a debilitating or dangerous condition.
Writing. Questions for discussion. What is the main idea of the article? What is the difference between reconstructive and cosmetic surgery? Give 2 examples of each one.
Grammar structure 2. Determiners. Determiners are words or phrases used in front of a noun to clarify how the noun is being used. They can define something or someone, state the amount of people, things, or other nouns, state possessives, state whether something or someone is specific, state how things or people are distributed. Quantifiers are special determiners that are used to state quantity or the amount of something without actually stating the number. They answer the question how many and how much. All, 100%. Nearly all, most people know the advantages of aesthetic surgery. A lot of, some people go for treatment in the USA. Not many, few women would like to take the risk. No one, 0%, gets dermal allergies anymore.
Writing. Exercise 2. Rewrite these sentences using quantifiers. 1. In Colombia, 60% of women get liposuction surgery. 2. In Chile, 80% of teenagers like to have cheek augmentation. 3. In Iran, 10% of men have been circumcised. 4. In China, 35% of the people have autoplasty. 5. In India, 0% of women get mastopexy.
Cosmetic surgery. Cosmetic surgery for personal enhancement is very popular, as suggested by the 11.9 million cosmetic procedures performed in 2004 in the United States alone. Although some may harbor a dim view of cosmetic surgery, seeing it as frivolous and upsurge in the number of procedures performed annually indicates that cosmetic surgery has become acceptable to the typical American. There is increasing concern about cosmetic surgeries not completed in the United States, especially liposuctions performed in the Dominican Republic. While liposuction is considerably cheaper there, 6 women were reported to have returned to the United States from the Dominican Republic with an infection after having liposuction surgery in 2004. In 2001, a Puerto Rican woman died in the Dominican Republic after contracting an infection during liposuction surgery, a case very widely publicized by a Puerto Rican newspaper. Cosmetic surgery is becoming more popular as less expensive and better techniques are being developed. There are numerous types of cosmetic surgery that can be performed. The most common types are listed below. Most of these surgeries are widely known by their common names. Abdominoplasty or tummy tuck involves reshaping and firming the abdomen. Blepharoplasty or eyelid surgery involves reshaping the eyelids or the application of permanent eyeliner. Augmentation mammoplasty is commonly referred to as breast enlargement and refers to artificially increasing the size of the breasts. Muscle sculpting is the removal of the fat layer on top of a specific muscle group in order to reveal muscle definition. Chemical peels remove acne scars and sagging skin. This procedure is not technically surgery and can be performed by a cosmetologist. Mastopexy or breast lift procedures raise sagging breasts. Rhinoplasty or a nose job refers to the reshaping of the nose. Otoplasty or ear surgery involves reshaping the ear. Retidectomy or a facelift refers to the tightening or removal of sagging facial skin. Suction-assisted lipectomy or liposuction involves the removal of fat from the body. Circumcision is the removal of the penis foreskin.
Chin augmentation is the sculpting of the chin or jaw using silicone implants or by reshaping the jawbone. Cheek augmentation involves using implants to emphasize the cheeks on a person's face. Collagen injections are used to restore a youthful appearance by smoothing and plumping up the skin.
Writing. Questions for discussion. What is the main idea of the article? What is liposuction? Do you think liposuction is a dangerous surgery? Explain your point of view. What are some advantages and disadvantages of cosmetic surgery?
Related disciplines. Hand surgery is not strictly considered plastic surgery, as it is also performed by orthopedic surgeons as well as fellowship-trained general surgeons. However, many hand operations such as reconstruction of injuries, replantations, rheumatoid surgery, and surgery of congenital defects are performed by plastic surgeons. Maxillofacial surgery or surgery involving the jaw is not usually considered plastic surgery, as it is typically used to correct serious disease, injuries, and defects in the head, face, jaws, and the hard and soft palate. However, there is a significant overlap of techniques and procedures between maxillofacial surgery for medical reasons and maxillofacial surgery for cosmetic reasons. Craniofacial surgery mostly revolves around the treatment of pediatric congenital anomalies such as cleft lip and palate, craniosynostosis, and other disturbances in facial growth and development.
Addiction to cosmetic surgery. Some people appear to become addicted to cosmetic surgery, possibly because of the body dysmorphic disorder, which is a psychological condition where the affected person is excessively concerned and worried by a perceived defect in their appearance. Sufficient amounts of repeated cosmetic surgery can lead to irreversible damage to the normal body structure. However, due to the high cost of repeated cosmetic surgery, this disorder is generally limited to the wealthy.
Grammar structure 3. Future tense. Will. Will and won't are used to talk about the future. Will is positive and won't is negative. I will be late tomorrow. John won't be at the party next Saturday. Use will and won't to. A. Make predictions. In the year 2050, people will live under the sea. B. Make an offer or promise. I'll buy you a drink. John will help you with that box. C. Make a decision about the future at the same time as you speak. Sorry, we don't have any tea. That's okay, I'll have coffee.
Form. Number 1. Will is the same for all persons. I will go, you will go, he, she will go, we will go, they will go. Number 2. Always write a verb in the infinitive form after will. You will be happy when you hear the news, instead of you will happy when you hear the news. Number 3. You can contract will to ll for pronouns. I'll buy it. We'll be late. He'll be late today. They'll be delighted. But don't contract will with names. Mark will be late, not Mark'll be late. Number 4. To write questions, write will before the subject. Will you buy me a drink? Will Tom get the job? Number 5. The short answer for will questions are yes, I, you, he, she, they, we will. No, I, you, he, she, they, we won't. Do not contract will in short answers. Will John be late? Yes, he will, not yes, he'll.
Group writing. Questions for discussion. Is hand surgery considered a field of plastic surgery? What is maxillofacial surgery? Do you think people can become addicted to cosmetic surgery? Explain your opinion. Is cosmetic surgery expensive in your country?
Research spot. Look for more information about Number 1. Risks of plastic surgery. Number 2. Plastic surgery's gone bad. Number 3. Famous plastic surgeons.